Okay, here's the 10 categories. Now we're going to go through them one at a time. So let's do that, and let's start off with first infections. Now with infections, in general and in summary, this is the allopathic approach. It's a very good one. They want to cleanse and dress it. They use antibiotics, antiseptics, and drugs based on types. And in some cases of gangrene, advanced gangrene, etc., they actually even use surgery. They have to cut out the organ or cut out the limb or whatever that seriously infected part of the body is. Now, from an original medicine standpoint, of course, there's also non-drug cleansing where appropriate, but the focus from an original medicine standpoint is not so much on antibiotics, antiseptics, and drugs. It's on a cleansing diet and or fasting. So let's look at the second underlying cause. So we talked about infection. The second one is inflammation. And from an inflammation standpoint, again, the allopathic treatment is primarily steroidal and non-steroidal agents. The anti-inflammatories, you're very familiar with that. And again, in advanced cases, surgery is involved. From an original medicine standpoint, you want to identify what are the laws that are broken, what are the causes and contributing factors, and they are over 95% of the time dietary and lifestyle factors. And so by making the appropriate modifications, you can address that inflammation using original medicine. The third is malignancy. Now I'm going to park on this for about a minute or two because this is one that a lot of people are afraid of, and this is what causes a lot of angst. So malignancy is, of course, cancer and cancer-related kinds of items. And the allopathic approach is pure and simple: chemo, radiation, surgery, biopsy. Now, there is an original medicine chemo, radiation, surgery, and biopsy. We have some 80 to 100 trillion cells. And as I started to say in the beginning, there's all these sources of toxins from air, food, water, medications, grooming products, household products, all kinds of things. And if you look at over on the left here, where you have that toxic accumulation, that's where you start having all of these disease processes. So if it's the joints, it's arthritis, all the way through if it's brain, dementia, Alzheimer's, etc. And a lot of this accumulation of toxins are in the body fat. And if you don't have an effective elimination of those 5 organs of elimination, that's where you start having that buildup. And if you don't efficiently eliminate that buildup, it can lead, and many times lead, to cancerous events. So next is toxicity. Allopathic is, again, antibiotics, drugs, surgery, chelation. Now there is an original medicine chelation, cleansing diet, fast, and again we talked about all this accumulation, and herbal chelation. This is a nice little remedy. As a matter of fact, it's actually tasty. From an original medicine standpoint, it's multifaceted. It goes across many different signs and symptoms because it's diet and lifestyle. And whatever you do to help one part of the body is enhancing other parts of the body. So it's not a focus on signs and symptoms, it's a focus on laws. Now, trauma. Now, if you notice over here, the allopathic approach is surgery, post-surgery, drugs, and rehabilitation. And you notice over here in the bottom, I have this underlined, and I want to make the point. When it comes to trauma, there is no powerful system in the world than Western medicine. And for trauma, though, original medicine plays a complementary role in terms of proper healing and a supportive role, not the primary role. And there's all these things. This is original medicine morphine. That you can help the pain with a lot of different various herbs out there that are many times, not all the time, many times are just as powerful and effective as the morphine and a lot of the drugs. Sixth one is psychiatric. And again, from an allopathic standpoint, drugs, surgery in rare instances. But original medicine also has, a lot of the mental issues, the emotional issues. And the people who know rbti a leg up on everybody else in the naturopathy field, because a lot of times it's low sugars, low salts, and things of that nature, and which RBTI exposes. Without RBTI, you won't know this, but a lot of, but when you really get, when you combine, as Seth said earlier, original medicine and RBTI, over 90% of the psychiatric problems go away. And then genetic is number 7. And then from an allopathic standpoint, it's interesting. What they're trying to do now is make or replace the missing gene or protein. So they're doing all this analysis, and it's talking about which chromosome is missing. And then they want to tailor a pharmacological approach to the therapy to one's genotype. But from an original medicine standpoint, optimize the diet, lifestyle. Now you want to acknowledge these genetic predispositions, but if you know you have these genetic predispositions, you just might not be able to take liberties that others that don't have the genetic predisposition. So understand what they are, and then optimize that original medicine diet and lifestyle approach. Iatrogenic it means, if you look it up, it's anything relating to illness caused by medical examinations or treatment. These are medically induced, and there are over 2 million severe adverse reactions from properly prescribed drugs. That's not me saying it. Google it. Dr. Google will tell you. Professor Google will give you the answer to this one. Professor Google will also tell you that over 100,000 deaths per year. I think it was 118,000 last year. It's always over 100,000 from properly prescribed drugs and properly executed procedures. Now, nosocomial means a disease originating in a hospital. The reason why I'm not spending a whole lot of time on this is because if you're practicing original medicine, you're not doing 8 and 9. So, do original medicine. You don't need to even worry about those, because you're not going to be in a hospital unless you get shot or get run over by a Mack truck or something like that. And then it's worth the risk. Otherwise, it's not worth the risk. And then idiosyncratic is my favorite one. And it's a nice sounding word. And it's funny when my clients like to give me their reports, and they read in this, and this is a tumor of so much mass and so many centimeters of an idiosyncratic nature. I always ask my client, you know what that means? And he said, no. I said, is it good? You know what it means? I don't have a clue. It means unknown cause. So just because your parents and your grandparents, etc., provide you this genetic profile, that doesn't free us from taking the responsibility of understanding what laws were broken, unbreak those laws, and then avoid those wrong habits of their parents by correct living and place themselves in better conditions.